Hello, my name is Dr. Ajay Randive. I am a knee and shoulder surgeon. Today we'll discuss advances in joint replacement surgery. Here we are going to focus on knee replacement surgery. The current advances in knee replacement surgery are: one is minimally invasive knee replacement surgery. In this surgery, we open the joint through a very small incision and do all the surgery through this small incision. There is a special instrumentation, minimally invasive surgery set is used for these surgeries. The advantages of this surgery are: the recovery is very fast, the surgery is painless, and patient can walk the very same day. The next advance is robotic knee replacement. In robotic knee replacement, what we do is we feed all the data of the disease to the robot. The robot decides how much cutting is done from the joint, which parts are to be corrected, which axis is to be corrected, and after correction of the axis, the instrumentation which the robot use to cut a few cuts from the bone. As the robot is doing the cutting, the percentage of correction is almost 100%. With the best of the hand, the percentage of correction can be 98%. So 2% extra correction is achieved with robotic knee replacement. Because the robot has already calculated which part is to be cut, there is less dissection, less blood loss, less pain, and early recovery in robotic knee replacement. The third advance is, instead of doing total knee replacement, partial knee replacement is done. For example, the knee has got three compartments. One is medial joint compartment, the second is lateral joint compartment, and the third is patellofemoral compartment. All these three individual compartments can now be changed depending upon which is damaged. The advantage is that the rest of the joint is natural, the recovery is very fast, range of motion is full, patient doesn't have any pain, and patient has natural feel of the joint. So these are the current advances in knee replacement. Apart from this, the advances also involves improved metallurgy. That means the metal is better, the plastic insert is better, there are different surfaces coated such as oxynium, gold, and titanium are used, and the longevity of the implant has improved. So these are the advances in knee replacement.